morning, everybody. My name is John Poole. This year I have the honor of serving as chair of MEDAC, and I also have the privilege of serving as chair of AMPAC, the AMA's Political Action Committee. For those of you that know me, my next line is, if you're in medicine, you're in politics. And for those of you that know me, my next line is usually, I'm here to ask you for money, but I have a more important job to do right now. I can't believe I said more important. Anyway, it's my distinct privilege to introduce a governor of New Jersey. You know, the Medical Society of New Jersey was founded in 1766. We're the oldest professional society in the country, and it struck me this morning as I listened to the 221st president of the Medical Society, Dr. Schultz, open our first annual advocacy conference. What better keynote speaker could we have than the 55th governor of the great state of New Jersey? You're here to hear him speak, not me, so I don't need to go through his whole resume. You know, he's in the second-term Republican governor elected with a greater than 20% majority in a fairly blue state. He's chairman of the Republican Governors Association. What you might not know is that when he practiced law, he did a lot of defense work for physicians, so he understands our issues. You're here to hear him speak, not me, so it's my honor and privilege to introduce to you Governor Chris Christie.
Thank you. Thank you very much. Well, thank you all very much, and it's great to be back. Thank you all for the invitation. I'm really happy to be here this morning and to talk to all of you about some issues that I think are very, very important. First, I want to thank Dr. Ruth Schultz on her term as president, more importantly, for her commitment to the practice of medicine and protecting the health of the citizens in New Jersey, and my sincere congratulations to your incoming president on being elected the 222nd president. I thought being 55th governor was pretty good, but 222nd president of the Medical Society of New Jersey. We, of course, continue to look forward to working with the Medical Society and all the folks that you represent in trying to make sure that our state becomes every day a healthier and better place to live. I've been spending a lot of time in my first 4.5 years as governor talking about the issue of drug addiction. And the reason I've spent so much time on it is because I suspect that that issue has touched, if not every person in this room, directly or indirectly, and probably almost every person in this room. And I'll start off by telling you how it has most recently touched me. I went to law school here at New Jersey at Seton Hall. And, you know, for any of you who have experienced, as we all have, I suspect in this room, graduate education, especially challenging graduate education, you grow particularly close to the people who you go through that experience with. And in a larger class like all of us were probably in, you wind up having a few folks who become part of your study group, become your social friends, and then ultimately, because you also share a profession, become your lifelong friends. I had a similar experience to that with 3 men that I went to law school with. We have been friends now for this fall 30 years. I entered law school in the fall of 1984. And none of us knew each other before we entered law school. We became part of the same study group, and we worked together for the 3 years of law school and become friends, been at each other's weddings, been there for the birth and raising of our children, and all of the great things that happened and has happened to us and have happened to us in our career. If you get in a small group of people, like a group of 4, there's always kind of one that stands out when you're in school, right? There's always that one who gets the better grades. It's the one who seems to get it more quickly. One of the 4 of us was that guy. Got better grades than all of us, was the associate editor of the Law Review. On top of it, he was the best looking of all of us, married an incredibly beautiful woman who became a doctor, and had 3 beautiful girls, 3 beautiful young girls who today are 19 years old, 15 years old, and 13 years old. About 8 years ago, I got a call from the mother of this friend of mine. Now, I had not heard from his mother probably in 20 years. And she said to me, I assume you heard that my son is separated. Now, I'm talking about friends like we went on vacation every summer together. We went on vacation every winter together. And I said, no, he hadn't told me. She goes, well, there's something else I need to tell you. She said, I think you and your other two friends need to come to my house tonight and do an intervention with him. I could tell you that I had absolutely no idea that my dear friend was addicted to prescription drugs and alcohol. I knew he had been having significant trouble with his back and had been seeking treatment for that, and had some surgery on his back. Knew he was in a lot of pain. He was an avid runner and wasn't able to run anymore. But what he became was addicted to prescription drugs, supplemented by wash down with vodka, OxyContin and Percocet. We went and intervened that night at his home, his mother's home, where he was living. And of course, he had all the excuses that every addict has, that he had it under control, that his wife misunderstood, that he was going to AA and he could handle it. And we all prevailed upon him to go into treatment. That was 8 years ago. And in the 8 years since that time, he's been to 12 different treatment facilities in 3 different states, hadn't seen his children for 4 years, and 3 weeks ago, I sat at his funeral. He died at 52 years old, alone, in a hotel room in West Orange, New Jersey, with an empty bottle of Percocet on his nightstand that had been filled 10 days earlier, and an empty quart of vodka. There was no note. We don't know whether he did this intentionally or whether it was just the next step in his addiction. His wife is my physician and my wife's. His children now no longer have a father, and quite frankly haven't had one for half a dozen years. And I can tell you that all of us, really bright, educated, caring, concerned people, did everything we thought we could to try to help cure his illness. But as all of you know, both from your professional experience and your personal, I trust, there are some people who get held by this demon and can't let go. And so we sat at a funeral at a small church in West Orange with 3 beautiful young daughters now without a father, an 82-year-old mother who blamed herself for the death of her child. And yet I can tell you that the one constant during the 8 years of this experience was he never once, from what we could tell, bought these drugs illegally. Never once. Because, he'd present himself as a upright, respectable lawyer, going to different doctors all over the place, and continuing to feed his habit. The U.S. government last year spent over $15 billion on the war on drugs. That's over $500 a second in this country that we spend on what we call a war on drugs. Every 4 minutes in states that have drug courts, like ours, every 4 minutes in America, an offender is sent to treatment instead of to prison through a drug court. I could tell you that my commitment to this was strong before the events of the last few weeks of my life. It's even stronger now. Because this friend of mine, he also had brushes with the law. Not serious brushes with the law. He didn't commit robberies or burglaries like many drug addicts do to feed their habit. Now, he kept cracking his car up into things. And every time he went to court, excuses were made, and yeah, he was punished, and they took his license away for a while, and sometimes he'd drive without his license. And he had brushes where people knew this guy had a problem, a real serious problem. And the legal system never intervened to try to save him from himself. So we're going to continue to push for things that help to save lives, because that's what this is really about. The war on drugs has been a failure, a well-intentioned failure, but a failure nonetheless. If we're spending $500 per second to defeat drug addiction in our society, it seems to me we're spending it on the wrong things. What we need to understand is what I trust everybody in this room understands, which is this is a disease. This is a disease that needs to be treated and understood. This is not a disease where we're going to cure people by throwing them into jail cells for a period of time, where despite our best efforts, they still get drugs in prison. They come out addicted, and we wonder why they continue to commit crimes and why they continue to be addicted to drugs. And politicians in Washington and in state capitals say, well, if we just make the penalties harsher, that'll teach them. That misunderstands this problem, doesn't it? My friend was not stupid. He was incredibly smart, partner in one of New Jersey's biggest law firms, a rainmaker of significant millions and millions of dollars in legal fees a year. This was not a stupid man. It was a sick man who could not figure out how to deal with his illness. And too many of us looked the other way or thought it was a matter of willpower. And so we need to do things to save lives. That's why recently we authorized a pilot program that I intend to have go statewide to give emergency medical technicians and police officers the ability to use Narcan. Heroin overdoses have now become an even larger epidemic. And we've instituted this pilot program in Monmouth County and Ocean County, and if you've been reading the papers of late, it'll tell you that we've already saved a number of lives through the administration of Narcan. Now, there were some who argued to me, well, you're not solving the problem, you're papering it over. The problem is heroin addiction. Well, yeah, it is. Unless that's your child who's lying on the floor in the midst of an overdose that could take his or her life. Narcan seems like a pretty good idea then, doesn't it? See, we have to start to make these policies more personal. And we'll announce soon in 8 additional counties, as well as the state police, will be trained in and have the ability to administer Narcan, because our policies need to be about changing and saving lives. Our drug court program is expanding each and every year. More money that we're putting into it so that first-time nonviolent offenders who come through the court system get sent to mandatory inpatient treatment rather than prison. And that, I think, is critically important. We had an argument at the time. There were some members of the state legislature who said we should not make it mandatory because if they're not ready for treatment, they won't respond to treatment. Those kind of comments are beyond ignorant, in my experience. How many people have you actually seen, in your experience, who voluntarily come up to you the first time and say, I'm an addict and I need treatment, and I'm ready for treatment? I can only tell you that in my personal experience with this, not just with this friend of mine, but with others in my life who have had this problem, they never do. The first time it's always like, you're wrong. I remember a friend of mine who got in an automobile accident when I was a lawyer and called me for help. He was in the hospital. And the nurse saw me outside and said to me, you're his lawyer? I said, I am. She says, well, you need to know that we've tested him and there are barbiturates in his bloodstream and the police are coming to process him. So I went in to this friend of mine and I said, what were you on when you had this accident? What are you talking about? Crazy. I was not on anything. I was tired and I fell asleep. I said, well, when the police get here in a couple minutes and they charge you because you have barbiturates in your bloodstream, I think we need to come up with a different story. Addicts almost exclusively are never ready. That's why we do interventions. That's why we make things mandatory, because only for many of them, when they're exposed to what treatment can give you, do they understand that they need it. It's the rare person who has the self-awareness in that circumstance to be able to feel that, understand it, and surrender to it. And so I stood firm in making it mandatory, despite the protests of some, because in the end, if we make this voluntary, the population of it will be much smaller, and the number of lives that we have the potential to save will be much, much less. Often now, as with the friend that I mentioned off the top, the disease of addiction begins at home, in the medicine cabinet. For too many people, they think that drug abuse only pertains to heroin, cocaine, marijuana, things that you are illegal and that you can only buy on a street corner somewhere. They think it only happens in certain communities or neighborhoods, among certain ethnicities or income levels. But we know that's not the case. We know that it's happening all around us. And for many of the people in this room today, you know that any of those indicia that society has used over time to stratify this problem turn out to be incorrect. Every day, 40 Americans die from an overdose caused by prescription painkiller abuse. Every day, 40 Americans die from prescription painkiller abuse. Overdoses of these prescription drugs now kill more people in the United States than heroin and cocaine combined. So even if you believe that heroin and cocaine are a big problem, as I do, prescription painkillers have become a much bigger problem. In 2013 alone, New Jersey saw 6,682 admissions to state licensed or certified substance abuse treatment programs as a result of prescription painkiller abuse. That means the number of admissions to New Jersey's addiction treatment programs rose by 27% over the last 5 years and by 432% over the last decade. Now, New Jersey's prescription monitoring program has been an important component of the New Jersey Division of Consumer Affairs initiative to halt, slow the abuse and diversion of prescription drugs. Through Project Medicine Drop, New Jerseyans can dispose of their unused prescription medicines 24 hours a day, 7 days a week, 365 days a year, and to do so safely, securely, and anonymously at participating police departments, sheriff's offices, and state police barracks. Since the program began with 3 police departments in November of 2011, New Jerseyans have dropped off more than 22,000 pounds of drugs or more than 10 tons, to 77 medicine drop locations throughout the state. Now, I know there's significant amount of debate and discussion about whether physicians should be required to use the prescription monitoring program. I'm not here to argue that point with all of you today. What I'm here to argue to you is, don't make it necessary for the legislature and the governor to require you to do it. Engage in it voluntarily. My friend should not have been able to get another prescription of Percocet 10 days before he died, 8 years into his addiction, a dozen different treatment centers in 3 different states, a rap sheet riddled with driving under the influence charges, fired from 3 different law firms, draining his retirement account of nearly every penny left to his name. There should not have been a prescription bottle sitting on that nightstand at that hotel in West Orange 10 days before his death for 30 more Percocet. His problem with his back pain had long since subsided. And I don't know what other excuses he gave to well-meaning or not well-meaning physicians to get the prescriptions he got over the years. But, you know, laws become laws often, not always, but often, when politicians believe that society won't do something without being forced to do so, even if it seems to most well-meaning folks in society that it should be obvious that people should want to participate in a particular course of conduct. Let's not make this one of them. We need to be monitoring how we give out these drugs. You heard those statistics, and more importantly, the people in this room know this based upon your education, your training, your experience. We cannot do this alone, because if government does this alone, we will do it in a ham-handed, awkward, and probably less than effective way. If we work voluntarily together to raise the level of participation in the monitoring program, we can work together to make it more effective, less burdensome. In the end, we're going to save lives. If we don't do it voluntarily, if it's not me, it's going to be somebody else who's going to foist it upon you. Because these numbers can't be sustained, and they can't be justified. And what will happen is that someone much more famous or much more sympathetic than my friend will die. Maybe that person will be the friend of a state legislator who will then drop a bill that has that person's name on it. And let me tell you something. When a bill comes to a governor's desk that has somebody's name on it, it's really hard to veto it. Lisa's law, Jamie's law, this one's law, that one's law. Once they name it, it becomes really hard. And let me warn all of you, as a friendly warning for a guy who's reaching the end of his career as governor. That's the way it happens. And so if this group of professionals and the society that represents you is opposed to making the prescription monitoring program mandatory, then participate in it voluntarily and work to shape it. Because philosophically, I don't like to make things more mandatory. So you might skate with me for the next few years. But you never know who's next. You never know who's next. And so here's how you can help. The Division of Consumer Affairs has a prescription monitoring program that's voluntary. It's a resource you can use. You know that. To make sure that the patient sitting in front of you hasn't gone to several other doctors to stockpile drugs that will be abused and sold on the street. As of the beginning of last month, 11,753 practitioners have already registered, including 4,175 pharmacists and over 5,600 physicians. As a result of the division's outreach programs, more than 1,000 new users registered in the month of March of this year alone. And it's an impressive number considering that the program is voluntary and was only initiated by this administration in 2012. But to date, only 26% of licensed pharmacists, 20% of medical doctors, and 10% of dentists have registered. So while the raw numbers sound good, the percentages, in my view, are woefully low. This is a resource that you can use. His mother didn't tell me what doctor's name was on the bottle. And I didn't ask, because it didn't matter. My friend was dead. But I know that after his death, his mother called that doctor. And I can only hope that this was a doctor who made a well-meaning mistake. And if he or she did, can you only imagine the feeling that physician had? Someone who's dedicated their entire life to improving the quality of others' lives, to saving lives. To get the call from that mother to say, the Percocet that you prescribed to my son was the method he used to kill himself. All I know is that the physicians that I know and have worked with and represented in this state during my career would be heartbroken to hear that news, and would only hope that they could have done something to have helped this man to still be there for his children, to have another day of treatment, so that hopefully that next time would be the time when the treatment tools would work for him and his life would be saved. If we participate in this program voluntarily, we have a chance. We have a chance. If his pharmacist, where he got it filled, participated in the program, we'd have a chance. There's no guarantees in life. And when I was talking to his ex-wife, my doctor, just last week about this, we both said, isn't it odd that at the very same time, about the very same topic, you can have a feeling of both disbelief and inevitability at the same time. Sitting at that funeral, it was hard for me to believe that that box that I was looking at had my friend of 30 years inside of it. The brilliant and fun law student, the law review editor, the partner in the big law firm, the guy I went surf fishing with at the Jersey Shore, the guy that I stood with as each of his children were baptized, the guy that we went to baseball games with. But at the same time, knowing that after the struggle of the last 8 years, it seemed inevitable to both of us that we would get that phone call that I got 4 Sundays ago. They found him in a hotel room by himself. That's the way his life ended. And I have to tell you, when the phone call came in, I was so sad, but not at all surprised. And so we know that if we don't intervene with folks, that there's inevitability to this disease. So I'm dedicating a lot of my time as governor to trying to raise awareness and take this out of the shadows. And I'm going to talk about my friend a lot now that I'm able. Last few weeks, it's been harder. I tried a few times at a couple of my town hall meetings when I got questions about drugs to start to talk about him, but I could feel myself getting too emotional. And that it would be difficult for me to explain to the 500 people in the room why the governor was losing it in talking about this issue. But time gives you an ability to deal with those emotions. And the story is really important for people to hear. Because in the end, it's just one story, unfortunately, of thousands across this country that are exactly the same. And we can work together not to eliminate every one of those deaths, but I believe that every life is precious and an individual gift from God. And if you believe that too, then the saving of just one life is a miracle. You all have a profession that allows you every day to participate in miracles. You play a role in making those miracles happen. And there's no one in our society, I suspect, who understands the fragility and the preciousness of life more than the people in this room and your colleagues who you represent. And so we've got to be able to agree on this. We've got to be able to work together on this. Because the core central meaning of what we agree on is that every life is worth saving. You make it your profession every day to do that. And I want to help. So we should be able to work on this together. So when I got this invitation a while back, I didn't know exactly what I was going to talk about. That's one of the really great things about this job. Every day something happens. And I'm driving somewhere wondering what the heck am I going to say? Something will happen. And it gives me something to say. But the other great thing about this job is that every day I wake up in the morning and I have the chance to do something great. I don't do something great every day because I'm human. But I have a chance to do something great every day. And that's an extraordinary gift that all of you have given to me by giving me the chance for 8 years of my life to be the leader of this state. And a lot of those years I'm going to spend dedicated to this issue and to trying to make a difference. I tell my children all the time when they ask me what the best part of this job is, I tell them it's the chance to help people that you probably will never meet and certainly will never know. So there will be lives, if we work together on this, that we will save of people that we probably will never meet and certainly will never know. But that act is just as miraculous and just as precious as if we knew the person. I couldn't save my friend's life, no matter how hard I tried. But that failure doesn't excuse me from the obligation as a human being and as a leader to save the next one. And I'd suggest you have the same obligation as well. So thanks for giving me the chance to talk to you about this morning. I appreciate it very much. I know we have some questions from somebody who's going to come up here and ask me a few questions that have been preordained. So let's see how I do. Thank you very much.
First of all, Governor, I want you to know that the Medical Society and Organized Medicine shares your concern with this issue. Just this morning, Dr. Stack, the president-elect of the AMA and national expert on this issue, gave a talk about it. And We have some upcoming events, CME events with a Partnership for Drug-Free New Jersey on this very issue. I've registered for that program, and I encourage all the physicians in this room and in the state to register for the prescription drug monitoring program. So there's a couple of questions that we have. I'm going to start with the medical students. They're our future. New Jersey has one of the most active delegations in the AMA and in the State Medical Society. So the question was that medical student tuition has gone up about 40% in the past 6 years, and the average student graduates with $179,000 of debt. Is there anything that can be done to slow the rate of growth of that?
Well, I may have thought there was about a week ago. And then, I woke up on Monday morning and got a call around noontime telling me I had an $800 million hole in our budget that I had to fix in 30 days. That's sobering. After you've already paid 85% of the bills and you have 15% of the money left. Listen, I'm going to be talking about this more and more and more over the course of time about every subject that comes up. I am very concerned about the debt that our undergraduate students and our graduate students leave education with. It's crippling. And I'd like us to commit more resources at the government level to support higher education in the state. I think it's good for our students. I think it's good for our economy. I think it's a smart investment. But here's my problem. In the budget that I just proposed in February, the budget was set to increase by about 4%. Of that 4%, 94% of the 4% goes to three things: pension, health benefits, and debt service. 94 cents of every new dollar goes to those three things. Now, I've been yelling and screaming about this for 5 years. I got some pension reform in 2011. We need more. And we need health insurance reform in this state as well. All across the state, but certainly in the public sector. Consider this for a second. Next year, fiscal year 16, for the first time in New Jersey history, we will spend more money on retiree health benefits than we spend on active employee health benefits. Now, I don't know where we think we're going here, but I can tell you we're going down the toilet. That's where we're going. Our health plan that we give to state employees, which they love, and believe me, they should, because the Obama administration has termed it a Cadillac plan. And in 16, you know what else is going to happen? Under Obamacare, the state of New Jersey and all of our employees are going to have to pay an additional tax to keep that plan. So we have this extraordinarily rich, expensive plan. Believe me, there are times when I go into my pharmacy and I am embarrassed by how little I have to pay. Embarrassed. Because I know you're paying for it. Not me. You are. Yet there's no will in the majority of the legislature to change that. Why? Because their political patrons are the public sector unions. Heaven forbid we talk about them paying a competitive rate and have a health insurance plan that mirrors what's going on in the private sector in any respect. I mean, this is a plan with $10 copays. I mean, I don't know. Anybody else got $10 copays? Pension plans that are paying people exorbitant amounts of money for years that we never anticipated they would live. I mean, that's the truth. They made these promises when they thought everybody's going to die. Said, well, they'll never collect this money, so why not tell them we'll give it to them? Guess what? Now they're living. And they're not living even as long as we thought they would. They're living 20 years longer. I can't make tuition lower unless I deal with those problems. And believe me, when I bring this up, this becomes a partisan issue. There are not many of these issues in the state that I haven't been able to fix in a bipartisan way, but this one becomes partisan. And we need some courage on the other side of the aisle. Because you know what? They know the math too. And I had a leader of the legislature say publicly recently, Governor's overemphasizing this problem. We're going to grow out of it. You know, when Republicans used to say we were going to grow out of problems, Democrats used to say we were crazy. Ronald Reagan used to say we're going to grow out of this problem. I can remember Democrats screaming and yelling about, you'll never grow out of the problem. But when it's their ox being gored for their supporters, all of a sudden now, oh, we're going to grow out of the problem. Don't worry about it. It is inevitable. I'll give you one last thing, which is the longest answer to can you keep graduate tuition lower than you've ever heard in your life. But remember one last thing. City of Detroit, bankrupt. Why? $2 billion in cash, $11 billion in debt. Of the $11 billion in debt, $9.5 billion of the $11 billion was pension and retiree health care. $9.5 billion of the $11 billion. Politicians love to make promises, and this is both sides, by the way. It was a Republican governor who upped the amount of value of the pension with absolutely no backup to fund it. It was a Republican governor who approved 20 and out for police officers. We've all contributed to the problem. I'm standing up now and saying, I'm the guy who inherited this mess, and I'm willing to fix it and take the political hits for it. I need some partners to be willing to do that, because if we do, this state will still have enough growth, if we get that under control, to help graduate medical education and undergraduate education in this state, to help fund hospitals in a way that will keep them open and efficient and operating for people, to make sure that we're investing in K-12 education, to make sure that we're investing in things like drug court and the things that we want to do to help make it a better society. But I'm telling you, we're not going to be able to do it if we continue down this path of saying to everybody who's retired, don't worry, we're not going to touch a penny of it. You don't have to share in the sacrifice. If we do that, we're not going to get anywhere. So I'd love to lower what happens for medical students in this state, law students, undergraduate students, but I don't have the money. And I am not raising taxes again, because you see what happens with this hole in this budget? How about this statistic? Everyone says raise taxes on rich people. Raise it on them some more. 40% of the income tax in this state is paid by 1% of the people. How about this one? 10 families in New Jersey pay more in income tax than the bottom 2 million filers. We raise taxes on those 10 families and they leave? And I'm not talking about a theoretical thing here, everybody. 10 families could go. And they don't even have to leave permanently, right? Because if they're paying enough to pay more than the bottom 2 million, they don't own just one house, everybody. Those folks own a couple of houses in a couple of different places. And all they need to do is start spending a little more time in those places. You know they got tax advisors right now who are telling them, listen, you can spend this summer at the Jersey Shore, but then you got to get to the place in Florida for a while, and then go to the place in Arizona for a while, and as long as you're not 181 days in New Jersey, you can stick it to Christie and not pay his tax. If 10 families do that, 10, you think what happened this week is bad? Wait till the for sale sign goes up in front of one of those 10 houses. I'm going to be out there personally begging them to stay. And these are the people who the Democrats in the legislature, I guarantee you, in the next month, are going to say to you, raise taxes on them. Raise them up. We know that they figured out a strategy that blew a $600 million hole in your budget through their tax strategy, because the money we didn't collect is from the top 1%. The amount that was reduced, not those 2 million people who barely pay anything. It's the top 1%. Figure out a new strategy to not have to pay the tax. Those are the very people they want to raise the taxes on, as if they're stupid and aren't going to figure out a way not to pay it again. So we got to take a logical, hard look and make hard choices. And hell, man, I'm not running for governor again, and I'm willing to take the majority of the heat. Just need 41 votes in the Assembly and 21 votes in the Senate to do something logical and make sense. And we'll see if people have courage enough to be able to do it or not. It comes to my desk, you can count on the fact that I'm going to sign it, and I'll sign it in public with a smile on my face.
Okay. Sure. Okay. So. Well, as long as we're on a roll about spending money that we don't have, we're good about talking that in New Jersey. One of the questions was about Medicaid expansion. So the Affordable Care Act expands Medicaid access. New Jersey has some of the lowest payments to Medicaid providers in the country. Is there anything that can be done to correct that and increase access to Medicaid? Well, I figured we could stay.
Same answer. Same answer. Listen. We expanded Medicaid because in the short run, expansion of Medicaid is a winner for us because we have one of the most expensive Medicaid programs in the country as it begins with. So expansion has led to about an extra 100,000 people in the Medicaid program, thereabouts. And in the size of our Medicaid program, it was not, in my mind, smart to say no. Now, what would have been stupid would have been for me to sign a law that made it permanent state law to have Medicaid expanded at that level. Because then, if the Obama administration breaks their promise and goes down from 100% to 90% to 80% to 50%, then you'd be stuck. We're not. I did it by executive order, and I vetoed the bill twice to make it permanent because it's fiscally imprudent to make it permanent. Here's my deal, and this is what I say to conservative Republicans who yell and scream at me about expanding Medicaid. I say, my job is to be governor of New Jersey, and this is going to be a $220 million per budget year winner for us when the federal government's paying 100% of the costs. And they say, well, Governor, aren't you concerned about the federal budget? And I say, no. That's not what I'm hired to do at the moment. I'll leave it at that.
Would you like to make a comment about scope of practice issues? I'm going to quote my good friend Rick Scott, former president of the Medical Society of New Jersey, that talked about various groups want to get through regulation, but they can't get through education. Do you have any comments about advanced practice nurses that want to have independent privileges, or the psychologists that want to prescribe, or various other groups?
Yeah, listen, this goes back to my experience as an attorney representing physicians, which was about the first 7 years of my legal practice, was exclusively defending physicians in malpractice actions, privilege actions, those type of things. I'm very reluctant to see that kind of expansion. I believe there's other ways that we can find efficiencies in the way we administer health care to folks. And I am much more of a traditionalist in that regard. And I get lots of argument around my policy shop about this, but I have to tell you, my view on it is that scope of practice expansion in the ways, the examples you just gave and other ways that are mentioned are ones that I'm reluctant to look favorably on. I never say never, but I never say never, because you always got to look at things, and as I tell my kids all the time that one of the other good things about this job is it's like going back to school. Every day I'm forced to learn about things that I didn't know anything about before. I say forced because then I ultimately have to make a decision, so I'd like to know a little bit about it before I actually have to decide. But on this one, I have a pretty firm feeling rooted in my experience as a lawyer interacting with the medical profession, and I kind of think we've got other issues that are much more pressing to deal with than that one.
Okay, I was told one more question.
Sure.
So, we all know that New Jersey is a challenging state when it comes to medical liability reform. Is there any glimmer of hope looking down the future?
No.
Okay.
No, there's no glimmer of hope. I'll tell you a story, which I'm sure he would be happy to have me share with you. In my second week as governor, I invited in to meet with me the chairman of the Senate Judiciary Committee. Now, the chairman of the Senate Judiciary is a gentleman named Senator Nick Scutari. Now, you say, well, why did you call him in the second week? Every nomination a governor makes, whether it's for the judiciary, whether it's on boards, commissions, authorities, all has to go through the Senate Judiciary Committee. So you need to try to establish some relationship with the chairman of the Senate Judiciary Committee and have some working relationship so those things go more smoothly. So I figured, okay, I'm a relatively charming guy, so let's bring him in and see what I can do. I knew that Nick was a lawyer, but I really didn't know what kind of lawyer he was. So I figured we're both lawyers, so let's start that conversation. So I said, so Nick, you're an attorney, what kind of law do you practice? And I'm telling you, you can ask him this is the God's honest truth. He said to me, I'm an ambulance chaser. So I started to laugh. And he looked at me and said, why are you laughing? And I said, well, you're not really an ambulance chaser. He goes, no, yeah, that's exactly what I am. So I looked at him and I said, so I guess tort reform's dead, huh? And he looked at me without even the hint of a smile and said, you bet it is. That's why I say no. Because if you have a plaintiff's trial lawyer as the chairman of the Senate Judiciary Committee, through which any tort reform bill would have to go, that's why I said, not curtly, but definitively, no. I think we have to have tort reform in this state in a major way. Our state's getting worse and worse all the time on this topic. And I say this as a former trial lawyer. It's much worse than when I started practicing law 25 years ago. And it's going to continue to get worse. And we see that publications are now identifying certain counties in our state as in the top 10 judicial hellholes of America. Atlantic County is now, I think, number 7 on the judicial hellhole of America because our laws, both in direct torts, in class actions, and I've vetoed a lot of this stuff to make it more liberal since I've been here. But we need to have tort reform, serious tort reform. But I can tell you something. As long as you have a guy as chairman of the Senate Judiciary Committee who says that about what he does for a living, it's like, I have become somewhat realistic in this job over time. I'm willing to bang my head against the wall somewhat, but on that one, there's no hope, everybody. There's no hope because they don't care. It is, and this is another interesting part of a part-time legislature, everybody. It is not in his financial interest to do it. Let's be honest. He came into my office and said he was an ambulance chaser. Tort reform would inevitably slow down his business. He only gets paid, you guys get paid $49,000, right? 49? How much? 49.5? 49.5 in the part-time legislature, okay? So no one in New Jersey with the training and experience of the people that we have in the legislature is going to be satisfied with $49,500 a year in salary. So everybody has another job, another profession that they pursue. Even doctors. Herb? So when you have something that is direct, it's a very interesting ethical quandary, isn't it? No one ever talks about it, but it's kind of interesting. Maybe that's something that he should recuse on. Because I can guarantee you something, man. If I had a direct financial interest in something and I went to sign a bill, they'd form another friggin' committee down in Trenton to look into that. You could be guaranteed, man. It would be Wisniewski and Weinberg too, baby. They'd be like, forget about this bridge stuff. He's actually making money off something. Holy God, let's start investigating that. Right? So it's I always find this interesting. You know, I love, like, the legislature sends me these bills about transparency. They want greater transparency. Yet the Open Public Records Act doesn't apply to them. Absolutely not. You know, you see all these things that get reported in the newspaper. Under Oprah, the press got this from the governor's office. They got that from the governor's office. Let me tell you something. I want to be able to see their emails. Wouldn't you? How about we start seeing their emails on tort reform? And any conversations that happen about that, just to start with that question. So you sense my frustration and resignation on this issue. I'd love to come to the medical society. The easiest thing for me to do is go, well, you know, I'm working very hard on this issue, and I'm in intense negotiations with a number of different people in the legislature to try to craft a compromise that will bring a brighter day and a better environment for you to work in here in the state. Bullshit, everybody. It's not happening. And so I hate to end on that kind of dour note, but you know, the fact is there are certain realities in life that you got to deal with, right? And so we deal with the fact that the tort reform system in this state the tort system in this state definitely needs to be reformed. And that it's not going to happen as long as we have people who have a personal financial interest in not reforming it in charge of the committee that in fact would have to consider it and pass it to get it to my desk. Just a fact of life. And so I'll end with this because I've been told it's my last question. And, you know, I'm looking at the clock. It's 10 after 12. I'm over my time. And you may say, why is he still up there talking? Because you know what I have to do now? I got to go to Trenton, man. If you had to go to Trenton, you'd be saying to yourself, how can I elongate this answer a little bit more just to stay in Plainsboro? Wouldn't it be nice if I could do that? But I know you have other things to get to. So I want to thank you again for your willingness to host me this morning. I want to thank you, most importantly, which I did not do in my remarks, but I want to thank you for what you do every day. It is truly comforting to know that we have people of your training and your experience and your compassion who are here in the state trying to make it a better place for the people who live here. And since I gave you one other personal item, I'll give you another reason why I'm delaying. I was going to consult with Herb on this on the way out, but I'll just do it in front of all of you. I'm now 51 years old. And in February, I went for my annual physical examination, as all responsible people are supposed to do. And my physician, the woman I was talking to you about earlier, said to me, well, Chris, you're 51. It is time for your colonoscopy.
We have some gastroenterologists.
You know, already covered, buddy, already covered. I'll tell you, here's the thing. My wife turned 50. She goes to the same doctor. So the doctor said, I know you both are really busy. We'll take care of scheduling it for you with your offices. How nice. Nice to have your friend be your doctor. Except this is what she did. Mary Pat, and she's going to love that I announced this. Mary Pat had her colonoscopy this morning. I'm having mine tomorrow morning. So you, imagine this, imagine my life, right? You and Trenton are the only things that stand between me and colonoscopy preparation. So if you wonder, why would I elongate my time before the medical society? The people in this room understand it better than anybody. It's me, 2 bottles of Gatorade, and a huge container of something called Miralax. That is what I'm looking forward to for my evening this evening. So tonight, when you're out to dinner with your spouse, enjoying a wonderful evening. Maybe you're going to a sporting event or a show. Whatever you're doing for a Friday night to wind down and relax, all I'm asking you in return for my entertainment of you this morning is just take one moment during that evening to say, geez, I wonder how the governor's feeling right now. Thank you all very much.
So a couple quick comments.